Whether you love electronic medical records or hate them, they are a fact of life in today's medical practices. But just as there are no one-size-fits-all patient treatments, the same is true for EMR software. As an interventional pain physician, you need software made by someone who understands your unique needs. Finally, that software is here. MD Reports IPM Solutions is an EMR software created for the unique needs of interventional pain physicians. MD Reports, a leading EMR software company, in conjunction with Dr. Laxmaiah Manchikanti, has created the EMR software you've been waiting for. If you've been missing out on meaningful use payments because other software packages don't provide what you need, and with government payments for EMRs soon expiring and penalties soon coming into play, now is the time to act. This software has been developed for interventional pain physicians with various modules, including a comprehensive initial evaluation, history and physical examination, referring physician's letter, and ambulatory surgery center module with all components in it. The software has standard ICD-9 diagnosis codes, as well as CPT codes built right in. These will be updated with ICD-10 and new CPT codes as they become available. These are prepared based on 1997 Medicare guidelines and are what Dr. Manchikanti uses. However, if you prefer, you may change it to the other option, which is not based on 1997 Medicare guidelines. Practitioners can also enter prescriptions with renew, refill, and automated allergy and drug review. Custom patient preparation instructions for interventional procedures can also be created. Your support staff will also love MD Reports IPM Solutions. The patient scheduler is easy and intuitive to use. Scheduling consultations, interventional procedures, and follow-ups is fast. Patient records can be found quickly and easily. Search by ID number, last name, or even first name. Reports can instantly be faxed or emailed from the software. Plus, inter-office communication and task management is built right in.
It is said that success in real estate is based on three things: location, location, location. For a medical practice, I have discovered that success is based on organization, organization, organization. I also realized that to stay not only in compliance but also to deliver high-quality patient care, three important things are documentation, documentation, documentation. When I first started my office practice, my history and examination took an hour with a 45-minute dictation and 4-hour transcription time. The result was a very large 20-page document. Thank goodness things have progressed. MD Reports IPM Solutions will help you get organized and save you time, money, frustration, and risk of fraud and abuse. This software will basically help you to implement the KISS principle, that is, keep it simple and safe. It is not about technology, it is how you apply technology for your needs and stay safe. As you have seen in recent press, electronic medical records not only can drive you crazy, but also can cost you a lot of money, not only in the reimbursement arena, but also with fines, fraud, and abuse investigations. It is well known that EMRs are distracting physicians from patient care during encounters. 67% of the physicians are not satisfied with the functionality of EMRs. The majority of physicians do not like the price. Almost 55% of physicians report spending $100,000 or more on EMR systems, including hardware, software, training, and consulting. However, even worse, there have been price increases up to $200,000 or more for 77% of the largest practices. No doubt, costs are increasing, and it is also impacting patient care. More than half of physicians believe that EMRs are making patient care worse. Above all, almost 2/3 of physicians would not purchase their current system. It is time for you to measure EMR pain points just like we measure patients' pain, namely high cost and poor functionality, and choose a system which is not very expensive but functional, does not take you away from the patient, and also provides ease of access with correspondence, e-prescribing, updates with ICD-10 and CPT changes yearly, and documentation with proper outcomes reporting. Most importantly, the fundamental issue is related to the meaningful use program, which is basically flawed. However, we do not have a choice and we have to follow it. By using this system, you customize documentation for each encounter without cloning. Cloning is a hot topic for fraud and abuse, which simply means copy and paste, carry forward, or repeating the same documentation over and over again. This system also has two ways of working. One is totally electronic. If you are used to it, that is great. If not, you can use both paper and electronic. Either way, it will facilitate proper documentation. Overall, not to repeat our president, if you like your present system, you can keep it. But if you do not, or you are experiencing any type of problems, go ahead and make an informed decision about a new system, and this is a system you can work with.
Let's take a look at the software's functions. Tabs across the top allow the user to switch between functions. Under initial assessment, drop-down lists allow the doctor to choose what is most appropriate when evaluating the patient. Drop-down lists can be found throughout the software where needed. The surgical tabs will take you through all three phases of the ASC setting. These templates will have important information carried over from the history and physical. Again, drop-down lists throughout the template allow this to be done quickly and accurately. The Progress tab is used for patient follow-up visits. This progress note contains information previously entered, as well as the doctor's dictation. Consent forms can be electronically signed by patients, including authorization and consent for operations, anesthetics, and other procedures. Important instructions following pain management procedures. Consent to treatment financial responsibility consent. Authorization for use or disclosure of healthcare information, as well as other consent forms. Additional key software features are patient tracking, a patient portal, the ability to interface with labs, pathology, radiology, and hospitals to get records electronically into EMR systems, custom reports for the physician quality reporting system, and alerts and notifications. Hard copies can be printed for those needing that, including a report that can be sent to the referring physician. MD Reports IPM Solutions is certified by the Office of the National Coordinator Authorized Testing and Certification Body and seamlessly integrates with other Health Level 7 compliant billing, practice management software, and hospital information systems. There's still time to take advantage of the government's incentive program for meaningful use. Affordable, intuitive, made for IPM physicians. That's MD Reports IPM Solutions, the EMR by an interventional pain physician for interventional pain physicians. Schedule a demonstration today.